Hi ma'am, I'm Rochelle De Vera from BSN 2A Group 2, and today I'm going to demonstrate the Leopolds maneuver for prenatal care. So for the description, Leopolds maneuver is a systematic method of observation and palpation to us to determine the fetal presentation and position. So for the purposes, first is to determine the presentation and position of the fetus. Second is to determine whether lightening and engagement has occurred. Third is to identify the maximum impulse of auscultation for fetal heartbeat. Fourth is to determine if the fetus is in normal state of flexion. Then fifth one is to determine if there is a presence of multiple pregnancies, and lastly is to estimate the fetal size and also to locate the fetal parts. So now let's proceed for the preparation. So for the assessment, first we need to assess the mother's capacity of to lay down on her back, and then also the fetal position. So now let's proceed for the planning. So for the planning, we need to prepare and assemble all the equipments that we need. So we have here the stethoscope, also the disposable gloves, and also the tape measure. So now let's proceed for the implementation. So first thing to do, you need to introduce yourself to the client, explain what you are going to do and why it is necessary. So next is you need to perform hand hygiene. So let's say for instance, I wash my hands, and then you need to observe other appropriate infection control procedure. So let's say let's have our disposable gloves, and then make sure that your hands is warm. Why? Because it can help us to prevent a contraction of the muscle. So let's say our hands are clean and warm now. So next thing to do is you need to provide the privacy of your client or of the mother. So when you are in a room, so make sure that the door is closed and also the window, and if there is a curtain, you need to close the curtain. Next is you need to instruct the mother to empty the bladder, and then also you can now position the mother in a dorsal recumbent position with her knee flex, and then you can also place a small what you call this one, small pillow or a rolled towel, and then place it under the right hip of the mother. So let's have that. Then after that, you can now expose the abdomen of the mother. As part of the privacy of the mother, the only part that we need to expose is the abdomen of the mother, and then properly drape the mother. So now let's proceed to first thing foremost, you need to remember that you need to stand at the right side of the bed, and then at the first three maneuvers you need to face the face of the mother, and then at the last maneuver or the fourth maneuver you need to reverse your position, and then you need to face the feet of the mother. But right now let's have our tape measure, because before we proceed to the first maneuver, or what we call the fundal grip, we need first to palpate the abdomen of the mother for us to determine the fundal level. So here you need to put the 0 mark of the tape measure, which is in centimeter, at the pubis, top to the fundus. So why is it in centimeter? It is in centimeter for us to determine how many weeks the baby is. So now the mother is in, the baby is in 14 weeks. So after that, now let's proceed to the first maneuver, or what we call fundal grip. Why we need to do that? We can now determine the fetal lie and presentation. So by doing that, as I have said, you need to face the face of the mother and then place your hands at the top of the abdomen, which is, you need to note that the palm is the one that you need to use, not your fingertips. So now palpate gently the top of the abdomen of the mother, but with firm motion. So here we need to determine if the buttocks or head of the baby is on the top of the abdomen by observing the consistency, shape, and also the mobility. Next is the second maneuver, or what we call lateral maneuver. There you need also again to face the mother at the right side. You need to face the face of the mother, and then here we can determine the fetal lie, presentation, position, and also the attitude. So now let's what you call this one? Now let's place our both hands at the both sides of the abdomen, and by doing this, you need to have a give it with a pressure, gentle, and then doing this, you need to move. You need to stay the one hand at the abdomen by moving the other hand at the top to the bottom. It's like this. Then after that, you need to stay this one again at the abdomen, and then do it at the other side. So why we need to do this? Actually, it can also give information for us for the fetal heart sound later on, which is we now determining the back of the baby. So now let's proceed to the third maneuver, or what we call first pelvic maneuver. In that, we can determine the the degree of engagement, wherein you need to put one hand at the down of the abdomen, which is you need to grip it like this, which is above the symphysis pubis, which is like let's say for instance this is the abdomen, which is the lower part, and then you need to grip it like this, which is at the in between the thumb and the fingers. It's like this. Yes. So now let's proceed to the fourth maneuver, or what we call the second pelvic maneuver, or the last maneuver. So like what I've said, we need to reverse our position to the wherein we need to face the feet of the mother. So the second pelvic maneuver, here we can determine we can determine the fetus head flexion. So how fair the head of our fetal head is flexion. So now here you need to put the first three fingers at the both sides of the midline of the abdomen, about 2 inches above the porpoise ligament. So you need to move your hand downward at the direction downward to your canal, birth canal, and then try to move your hands or your fingers to the other hands as far as possible. So now that's it. It's the fourth maneuver. Then you can hear the fetal heart sounds. So by doing that, you can use a Doppler, and by using the Doppler, you need to have an ultrasonic gel. So you need to put the ultrasonic gel and then use the Doppler if you have it, and then after that, make sure that you wipe the ultrasonic gel. But as I don't have a Doppler, and Doppler is not available right now because I don't have it, so I'm going to use my stethoscope, which is I'm going to use the bell part of the stethoscope. So like what I've said, the information from the second maneuver or the lateral maneuver a while ago, that we determine the back of the baby. So let's say for instance that the back of the baby is on the right side. So now let's hear the fetal heart sound. Then after hearing the fetal heart sound, now you can help the mother to cover the abdomen, and then you need to help the mother to move to the bed. So now let's proceed for the evaluation. So for the evaluation, you need to record all the findings that you have, like the fetal lie, also whether the presenting part is flexed or extended, and also if free or floating, engaged, also the presentation, the position, the fetal heart sound, and if there is a vaginal discharge, and if there is a abnormal findings, you need to report it. So that's it.